So we're going to go ahead and get started with our Project E3 Communities of Practice. I am taking attendance as y'all log in. So forgive me for looking down. I want to say welcome, and for those of you who I haven't met, my name is Robin Freeman. I am the Director of UA Currents. We are a unit within the University of Arkansas, Fayetteville, providing training, technical assistance to vocational rehab agencies. So we are excited to have you join today. Thank you, and I apologize for getting the word out kind of late this month. We always have big goals for January, right? New goal, new year, new goals, new me. So it didn't work out for me, the new me part. So it's a little bit late getting the word out. So I really appreciate those of you who were able to get on. And some of the ideas I had for our meeting for this month kind of fell through. So kind of did a pivot and wanted to spend time on today's Communities of Practice, just talking about where you are. I know we had a big event back in October with our Leadership Academy, but wanted to get caught up on how your sustainability plans are moving along and how we can help. I did get word from the project officers, Dr. Susan Flowers Benton at Southern University, that we would continue with the Communities of Practice through at least April. So I know we were all under the impression it was going to end in December, and I kind of had that thought there. And so she gave me that word, I think late December, that I wanted to continue with it in the no cost extension. So I am excited about that, Eric. That is great news. So I do though want to make sure that we have meetings that will meet your needs, that when we come together, that we have the topics aligned that will help you in your work, because these last several months have been all about sustainability. What do you need to make your project successful? What can we do to help you when all the money's gone and all the meetings are gone? What can we do now to help you sustain what you've been doing? So that's our goal. So I thought if we could revisit that in today's meeting, that would help me a whole lot to go out and seek presenters or arrange meetings that will help you in your efforts. So that's kind of where we're headed for today's meeting. And I've been reaching out to you to kind of get you with your states to get volunteers to see if you could present today and provide information about your plans, what you've accomplished, what you would like to see in terms of technical assistance. And so that's where our conversation will be today. But as always, we usually start our meetings with introductions. So we'll go ahead and do that. And then we'll get started with having just kind of an informal discussion today that addresses that topic of how we can help as you go forward with your sustainability plans. So we'll start with the roll call. And first up is California.
Hi, good morning. This is Araceli Holland.
Hi, Araceli.
Hi.
Good morning. This is Amory Aguita.
Hey, Amory.
Good morning. This is Devin Puente.
Good morning, Devin. Thank you.
Good morning. This is Cynthia Herrera.
Hello. Good morning, Cynthia. Thank you for being on today.
Thank you for having me.
Next up is Illinois. Do we have anyone from Illinois? What about Kentucky?
Hello, this is Twyla Hammonds.
Hey, Twyla.
Hi, I'm Roxana Robinson.
Hey, Roxana. Good to have you on.
I'm Nancy Tapley.
Nancy? All right. Awesome. Next is Louisiana.
Good afternoon. I'm Rosalind Davis.
Hi, Rosalind. All right, to Montana. Not hearing any. What about New Hampshire? All right, New Jersey.
Hi, this is Elaine Katz from New Jersey.
Hi, Elaine. New Mexico.
Hi, this is Eric Padilla from New Mexico.
Hey, Eric.
Hi.
Hi, this is Reyes Gonzalez from New Mexico.
Hello, welcome.
Hi, this is Joy Foreham from New Mexico as well.
Hello.
Hello, Lucinda Ramos from New Mexico.
Hi, Lucinda. Good to have you. All right, we'll go to North Carolina. Not hearing any. What about Oregon? All right, South Carolina.
Hey, this is Carmen Marshall from South
Hi, this
Carolina.
is Cassandra. Oh, I thought you said South Carolina. I'm sorry.
I did. Karma Marshall introduced herself. Hi, Karma.
Good afternoon.
Dr. Cassandra.
Hi, Cassandra from South Carolina.
Thank you. And Virginia.
Hi, this is David Leon from Virginia.
David Leon and Johans. You are muted.
Sorry. Hi, guys. Johannes Goodrich from Virginia. Sorry about that.
No, good to have you on. Thank you. And anyone that I missed?
Hi, good morning, Robin. It's Priscilla from California.
Hey, Priscilla.
Hi, good morning.
Good morning.
Good morning, Robin. This is Ismael De Leon from California.
Good morning. Good to have you on. Thank you all for joining. Let me go ahead and share my screen. I did do a little PowerPoint. It's not much. So we'll start that. And just like we did with the introductions, I'll turn it over to you. Can you all see that? All right.
Yes.
So what we'll do is have you each state go through, those of you who are here, and talk through the steps you've been taking to ensure the sustainability of your efforts. If you would like to share any lessons learned and any requests for technical assistance that you may have going forward as we meet in February, March, and April. So I'll turn it over to California.
Thank you. Okay, so for California, we had two goals. We wanted to increase services to the Hmong population in Fresno County, and we wanted to increase services to the Latinx community in Kern County. We had identified those as being populations that were unserved or underserved in those particular areas. For the Hmong population in Fresno, that was the team that we stood up first, and we implemented the E3 project there. We have gone from 0% of serving the Hmong population to 3%. So we have made some gains, so we're happy about that. In Kern, we haven't, the team hasn't stood up yet, so we don't have any data yet to report on that. So we plan on keeping our initial goals as we move forward, because we faced a lot of barriers with some internal work that we needed to do to start paving way for addressing some of the issues that we've had. So some of the things that we're doing right now, we have been, we took a few steps back, and we've identified that we need to redirect staff to build a couple of dedicated teams for this project, and not just, we had some volunteers here and there, and we didn't really have a dedicated team to address these two areas. So we're starting to develop those teams so that this is their jobs moving forward. The challenges that we have encountered, we had some systemic issues that we've identified that we've had to take on as well for California. We recognize that we didn't have the right people for the right job that we wanted to do. We identified that we have some systemic issues in our recruiting and hiring process and making sure that we have the right staff. We were working with very little data. We didn't know who our communities really were, and we weren't really understanding how poorly we were doing in reaching out to certain populations. So we identified that data was necessary. We also identified that training was essential and will continue to be critical for our staff. Everything from unconscious bias. We've done a lot of training, but it seems not to trickle down from the executive leadership piece. That needs to be in the field. We need to do a lot more in terms of unconscious bias training. We need to do a lot more in terms of cultural competency training. We've identified that our staff need to understand how to do some grassroots advocacy in the field and how to utilize our community organizations and kind of work from that perspective as a community-based organization service model when we're trying to work with and connect with some of those populations that we are missing. And of course, we had some competing initiatives across the state in the department in regards to the justice and inequality concerns that came up. And that's kind of quieted down because it kind of derailed us in trying to make some major impact in how we do business. So we're back to focusing on that. So, globally, we have to make some changes. We actually have to work with our diversity officer on recruitment and hiring efforts. So we're doing that. We're trying to figure out how do we integrate cultural competency training and unconscious bias training as part of how we do business and skills that need to be there, and not just something that's popular this year and for this project and then it goes away, because it's necessary in how we provide services. So what are we doing to support our plan? We are, like I said, redirecting staff to build dedicated teams. We've started a database initiative to really understand our counties and who our targeted populations really are. Reconciling that on a monthly basis with who we're actually serving based on our internal databases, and reconciling that with the staff that we're hiring to make sure that we're hiring the right people for the right job, and also looking at writing better duty statements and better job specs so that we are recruiting the right people. We are trying to move towards supporting a community-based service delivery model by having our staff actually out in the community at these different organizations instead of in our offices. Right now, we've been thwarted by COVID-19 because we're all just teleworking and nobody's mingling except on Zoom, but that's kind of helping us out right now. So what we know that we are going to need in terms of technical training is in two parts. We really do want to dedicate 2 complete teams. And when we do that, I think part of our need is going to be on the IRT, integrated, I always get this wrong because there's so many, we call it wraparound, we call it a California for all, we call it so many names, but the IRT model, I think it'll be effective if once we stand up our 2 teams, if we can actually have technical assistance, not just with our teams, but our community partners, because what we'd like to do is identify an interagency team of who our partners are going to be and how we can work together and staff cases together and make some inroads. So I recognize that that's going to be a need for us. And the other thing that we are looking for in training is in sustaining our advisory committees, the local advisory committees. We're challenged on trying to find the right configuration or trying to maintain those committees and not let them go without having discussion anymore. It's hard keeping all of our communities together. And so we're trying to find a way of how to build those interagency teams in the committees that can continue to meet, and we continue to talk about how we serve our client through all of our systems and how DOR can work differently and respond differently to our communities. So those are the couple of things. So that's about where we are at. I don't know if anybody else has anything else to add on our team.
Anyone else? Araceli, I do have a few questions for you.
Okay.
As you mentioned the IRT model, just additional training, especially for your interagency teams, supporting them on that model and how to integrate that. That seems pretty understandable. But in terms of the find your advisory committees, can you tell me a little bit more how many of those that you're speaking of that you want to provide some type of technical assistance to help them sustain the momentum?
Yeah, I'm hoping that we have one that we started off when we were working with Ellen, and unfortunately when Ellen left, it kind of also started falling apart because she was our lead. So we've been challenged trying to get everybody back at the table.
Okay.
And trying to continue in having those conversations. So what we're hoping to do is to have at least two local advisory committees, one in the Fresno area, one in the Bakersfield area, where we're bringing in those community partners that we're going to work closely with and providing services to our mutual clients.
It almost sounds like your advisory committee needs oh, the word just went out of my head all of a sudden. Not a sustainability, but a strategic planning session.
Yes.
Okay.
Yes.
All right. Anyone have questions for Araceli? You mentioned a lot of great stuff. You talked about dedicated teams to develop those two target populations, to reach the two target populations. You said you didn't know how poorly you were doing in reaching your target populations, like doing your outreach. And how did you find out that you were doing so poorly? What kind of led to that? Did you hear from the increase of 3% in the Hmong population, or how did you know that you were doing a bad job of reaching your group?
One was just informally looking at demographics in our local community and then matching that up to our database on our local database on who we were serving. And that was difficult for us because it's not something that our department was really prioritizing to track. So we had to dig through a lot of data. But since this project has started, we are dedicating more staff statewide to find ways of monitoring that information and being able to develop a plan for each regional director and district administrator, how a database that they can go in and start looking at that information for themselves. So we're still in the process of rolling that out, but it was something we had to go to our leadership and say, something needs to change because we can't operate this way. It takes us too long to identify who we are not serving.
And how are you using cultural competence and unconscious bias training to help with that awareness?
On the unconscious bias training, we took some of my district's training dollars and actually contracted somebody out because we wanted to demonstrate to our leadership how important it was for us to have this type of training. So we used it in terms of to help people identify that we are not meeting people as whole people when they come in the front door, that we're using our assumptions to decide what people need from Department of Rehab. We still found a lot of that kind of thinking in some of our counseling staff is, you've come to me so I can tell you what you need. And we weren't doing enough in terms of understanding where a person was and understanding that what we thought they needed, either their disability or their cultural background, their ethnicity, their socioeconomic status, that we weren't considering really any of that at all. And when we were, it was based on our own interpretation. So we rolled out a unconscious bias training, and it was more for people to understand their own biases and make them aware of how they view the world. And we've got such great feedback from that training that we recognize is something that we have to continue and do deeper, because it does shape how we treat the individual coming through the office immediately. And so we're looking at that, and we're also looking at it in terms of intersectionality. You know, it's we're not separate pots of people. We are people that have a lot of different layers, and we need to not assume we know a person's experience, and we need to meet them where they're at when they walk in the door. And we really, just judging from the trainings that we've been giving out and the feedback that we're having from staff, it's been a real eye opener for them, and they're getting some value out of looking at our clients through different lenses. And on the cultural competencies, again, we have a traditional method of cultural competencies in terms of, I just want to say maybe just old school, and here's how this group functions and their needs. But we find that it's the conversations when we invite people to talk about their personal experiences locally from their background is more helpful to us, because we have so many different nuances in our area. We're rural, we're agricultural, and we're very conservative. And what our potential clients face is different than what they face in San Francisco or San Diego. So we're really trying to be more culturally competent at a local level, if that makes any sense.
It does. Thank you. Great information. Appreciate you sharing. Any questions for RSLE or the California team? All right, we're going to move on to, I think, Illinois. Do we have anyone on from Illinois? I know we had some staff changes, so I don't know that I was able to get someone to present today. We'll move over to Kentucky.
Well, Robin, we are not nearly as fancy of a report as California just gave. So we, of course, and I hate to say COVID has like train wrecked us, but it has. But so like we were going to focus on working with our IPS folks in the mental health community a lot more, and the community work transition programs in our high school. And so since March, our agency is not allowed to do face-to-face. So it has really prevented us from like getting in with the high school students. Some of our students do in class, some of them do homeschool. A lot of our vendors and stuff aren't going into the high school because half the students aren't there. So it's just kind of derailed everything. But like our goal was to have a greater presence with the high school students and be able to work with their in-house job coaches more, get the word out more basically about voc rehab. The one good thing is we are still getting a lot of virtual invitations for the ARC meetings. So we're still getting in there to talk to the students. We're just not able to do it at a much greater rate that we had kind of planned on doing.
Can you tell me what ARC means? I'm sorry.
Oh, I don't even know what it actually means. But it's
Annual Review Committee.
Yes, thank you. I knew somebody else would know way more than. So a lot of times when a student's getting ready to transition out of high school, or they're kind of like getting ready, like their junior year, getting their senior exit plan together, they'll invite us to come in and talk about voc rehab and how we can help. So a lot of times those formal meetings with a nice big team, those are still happening, but not at probably large quantity we were hoping, but like one of our counselors in Somerset, he's had like 30 scheduled for January. So he's still able to get the word to these high schoolers about VR. A lot of times though, we're going in a lot sooner, and like a lot of the special ed classes were inviting us in, and we're not getting that invite because they're not in person anymore, you know. So I know we're still losing a lot of students that we could be reaching out to. The IPS, they are thankfully doing a lot of virtual sessions, mental health sessions. So it is a little bit easier for our counselors to meet virtually, but a lot of those numbers have even gone down. But we talked about how like this is really a great time for our staff to encourage people to get mental health treatment, because you don't have to leave your house and you can get treatment safely. Whereas before, a lot of people didn't want to have to actually go to the center, go out in public, be seen or whatever. So we were kind of using this as an opportunity to our advantage to get people into mental health counseling. And then just kind of developing that natural partnership with the mental health provider to kind of have like a little mini IRT team with that mental health professional. So we were kind of using that as like a stepping stone to develop the first part of the IRT. But our staff have faced a lot of challenges just trying to get people to want to work during this time, because a lot of people are afraid to go out and have to actually work in the community. But we keep meeting and we keep celebrating the small successes that we have. And the counselors are working with their job placement person, Tanisha, and she's actually working on getting like a community, a virtual community of our partners together so that we can meet and keep talking about VR and our missions, and then talk about this team building that we're trying to get developed, just so they understand like why we're reaching out to them and wanting to create these teams to support our consumers and stuff. So the counselors and the job placement staff have really been working hard to get this community built back up and start having virtual meetings and stuff. And then we decided that even though like Nikki was helping us from, I think it was NDI. I can't remember. NDI. Where's she from, Nancy? Do you remember?
IRT.
Well, she was helping us with it.
Oh.
Nikki Prowlis, but
I remember where she's from.
She explained to us that, you know, like, so they're officially gone, like all of our support is gone basically. But she explained that like we could like contract with them to do follow-up services and help provide us. So I felt better knowing that, yes, Nikki is from NDI. Thank you, David.
Okay. Okay.
So it was nice to know that you all aren't like just going away forever. Like now we could still pay for like very specific follow-up services. So that was a relief. So like, you know, she will always be there to kind of help us in the future. So that was really important to me to know that somewhere out there, somebody can still help us, you know, if we feel like we're really struggling. But the counselors and job placement, we all decided that we want to continue doing our monthly meetings, even though we don't have like the direction of Nikki anymore to help us. But one, we wanted to be like a sounding board, and that way we, you know, can share our ideas. the roadblocks that we're facing, and we just want to be like a natural support for each other. So I think as we end up kind of being on our own, we'll figure out like really then like, ooh, we are struggling in this area. We need to learn more about this or get additional training, or if we did attend something, you know, we can come back and share it with the group and figure out if it's going to help us or whatever, move along the way. So I think we just are probably going to have a lot of learning to do now that we're on our own, but it's really nice to know that you guys are still going to be there if we, you know, need to call on you. So
That's great, Roxana. Absolutely, we'll be here. And if we can connect you with any resources to help you provide technical assistance, we will do that.
yeah.
As I listened, I kind of had a question. You talked about the virtual community of partners meeting that you said someone on your staff is kind of organizing. And I wonder if I've been thinking a lot about like the community academy, and you know, that's a great opportunity. And I wondered if anyone in our group had done a virtual community academy, or if that was something maybe Kentucky was considering.
Well, see, we were lucky enough that Christina and DJ, you know, set up ours. So we had a wonderful community academy. So
was it in person?
Yes, because see, we got all that in right before the pandemic. So we were really lucky to actually experience what that was like and how it was set up. But I did hear that DJ has done virtual ones, but I myself, like, we didn't have one.
Yeah, has anyone else had one? Any thoughts on that?
Yeah, this is David. In Virginia, we had one. I wasn't really prepared to discuss that today, and I can't recall offhand if it was a second community academy in Martinsville or if it was in the Hampton Roads area. And I know Johans is on, he might have more, but I know we did plan and execute one virtual academy. I think, though, to be fair, it was in a community that had had one in person previously.
Okay.
Hi, Robin. This is Eric from New Mexico. John Walsh actually assisted us with putting together a virtual community academy, and it went very well. We did breakout sessions within Zoom, and so yeah, it was very successful, I thought. So very helpful.
It's great. Well, unless Roxana has anything else, we may skip, because I don't know, we may skip over to New Mexico next and let you all tell us what you all are doing. And I'll come back to Louisiana if we have someone who wants to present from Louisiana.
Hello, I'll go ahead and jump in there first, and then I'll let Eric talk about his area. I'm Ray Gonzalez, and I represent the Albuquerque metro area for DVR, Field Operation Director. And we have 3 priorities for the state. The first one being greater collaboration between partners in the workforce development system. And I think we accomplished that. In Albuquerque, we did do the community academy in person. It helped develop a lot of relationships. We had DVR staff there, plus other partner staff from workforce. And I think we continue to work together as far as a shared vision, and we definitely have developed relationships with our partners over the years. In fact, just yesterday, there was a business engagement event. It was a couple of days. It was between DVR and workforce staff. And we did trainings, and there was breakout groups, and we all worked within our region. So I think we've been doing pretty well as far as priority 1. Priority 2 was to develop an integrated resource team. And I have to admit, like the other state, that we are struggling with this. For the last 2 years, we've been trying to develop a pilot, but due to vacancies and COVID, it's been really difficult. One of the major partners, which is a mental health provider and substance abuse, they have a residential program in Albuquerque. They just been hit hard with COVID and vacancies. So we were really having a hard time getting that going, but we are going to have a meeting today and reassess that. I'd like to mention that our target population is working with mental health and substance abuse and trying to break down the barriers to employment in impoverished areas. So we have hopefully we can get the integrated resource team working. I know the grant's going to end, and I'm hoping that we can find additional support for this. Hopefully we can complete this pilot and then offer it Albuquerque-wide, because right now we're just using a couple of counselors for this pilot, and I like to offer it throughout the Albuquerque metro area and then throughout the state. So, and I think we need some support as far as training the rest of the state on that process. Priority 3 was implementation of new projects and programs. In Albuquerque, we did develop a job club with that one partner that I mentioned that works with substance abuse and mental health. So they have an ongoing job club, and they've been working with our workforce operator, Joy, who's on this call, for any resources that they may need, and also for referring over to workforce from their residential program. And Joy's also gone out and got a grant for mental health and peer support. So kudos to her. We were going to implement the trails model, which was basically a feedback loop between upper management, mid-management, and the ground level. And I think we're only half successful with that. Right now, it just seems to be upper management and mid-management, but it's a start. And so that's where we are in the Albuquerque area. And I'll let Eric go ahead and present in his Deming area.
Thanks, Ray. First of all, I just want to recognize Project D3, John Walsh, Russ Thielen, and Brian Ingram. They've been mentors, and we couldn't have gotten this far without their help. So I wanted to recognize them. Our main focus was mainly on the IRT model and establishing that as far as training. Overall, we have seen some successes, mainly outside of the Deming area. In the Deming area, we had identified various participants. However, many of those participants were unable to get in contact with them, or they wouldn't follow through with those appointments. So kind of had a rough start, but we did have some successes within Las Cruces. Our main focus other than that has mainly been on training. We focused on training our workforce partners, field staffs and management in the ADA. We coordinated with the Governor's Commission on Disability and the Southwest ADA Network in order to collaborate to develop various trainings, which includes DVR training, and then there was Title I, Title II, and then the Why We Think What We Think training, which is mainly focused on the mentality of, I guess, perspective that individuals may have that don't work with people with disabilities and why they may have those perspectives. We did also have a virtual community academy, which I mentioned, which went very well. Some of the other challenges have been that the VRC that was actually assigned for the pilot project for the IRT, she actually retired at the end of August. So I have a VR technician that took the lead, and then what we did was we rotated amongst the rest of Southwest New Mexico, that caseload. So I wanted to get all counselors involved and the whole area involved with the IRT model, which we did provide additional training on IRT, not just to DVR staff, but also to workforce staff. So we're trying to get all workforce partner system staff to understand the benefits of IRT and to hopefully use this on a regional level. And so some additional challenges that have came up recently is that in Deming, the agricultural sector has been hit pretty hard due to COVID, and especially the manufacturing sector. In Silver City, the mining industry, which pretty much is the main source of their economy, actually experienced complete layoffs. They shut down the mines temporarily. which also has a ripple effect on other economies within that area. So that's actually brand new that we just found that out yesterday. So we're going to be working towards strategies on how we're going to assist those individuals as far as unemployment. But as far as future goals, we plan on expanding IRT through the region, continuing to build on training, which Russ and Brian will hopefully continue to support us with. We want to strengthen those partner relationships with our workforce partners and to build a more cohesive workforce system instead of continuing to be in silos. We also want to develop a universal release of information form for the workforce system. That's one thing we've discussed. And then the trails model, it's still kind of a work in progress. We've identified some staff, but we still need to nail down what committees we want to use. And then we also want to establish ADA coordinators throughout the state and see if we can do a self-evaluation for our programs. So, or at least to see if we have a current one to break down any barriers for accessibility. And yeah, and that's it for me.
Thank you, Eric. I do have a few questions for you. Let's see, for New Mexico, I guess I should say. You both mentioned like the trails model as a way to, is that to, I've never heard of it, so I'm interested in learning more. It sounds like a good tool to use as far as closing the loop between communication between upper management and frontline staff. Is that the purpose?
Yes, and I got to give Russ the credit for naming that. It's teaming resources for alignment through integrated and leveraged services.
What's the T for?
Teaming. I'll probably have to write it in the chat for y'all, but teaming resources for alignment through integrated and leveraged services.
Trail so much better.
And that came in well, at least in Albuquerque, and I think Albuquerque was first. It came out of a community academy after a huge breakout group with all the partners. And we identified like maybe 5 areas that we'd like to focus on. I remember data being one, youth. I'll have to look at my notes for the others. Technology, stuff like that. And we wanted to have, upper management involved, mid-management, and maybe have some committees under each of these subject areas that are at the ground level that kind of provide it to mid-management, and mid-management provides it to upper management, and kind of a feedback loop through that way. So, and Eric, I don't know if you want to add some comments on what's happening down in Demi.
No, Ray, I mean, that's perfect. That's exactly, and yeah, Russ gets the credit for that. He pretty much developed it and he used it in Utah when he was the executive director of the VR system over there. And so it's mainly just a kind of a subcommittee structure to focus on a service model, and to identify any challenges and come up with solutions within the mid-level range, like Reyes had mentioned.
Yeah, keep it stopgap. Is that something you all can share with our group so that other states can benefit? Because I seem to hear from California that they're trying to address some of those communication issues as well.
Yes, ma'am. I can send you the attachments Russ had sent us.
That'd be great. I'll share those out with everyone. Thank you. It sounds like IRT seems to be a big theme for this group today, continuing some training, that maybe that would be a focus area, and maybe even opening up our meeting to include more of people in your agency and doing just a general training about IRTs. Would that be something that would be helpful?
Yes, definitely.
Okay.
Yes, it would be. Thank you.
Yeah, sounds good. Well, thank you both, Reyes and Eric. That's great information. We appreciate you. Yeah, I did hear, thank you for the update on Louisiana. So we'll keep moving forward. I did skip over Montana. I don't think we have anyone from New Hampshire today. And let's see, New Jersey wasn't going to be able to present today. So we are up to North Carolina. Do we have anyone to present from North Carolina? Not hearing anyone, so we'll move over to, I know I heard from Oregon, they were busy with other meetings today. And what about South Carolina?
Okay. Okay. All right. As far as Project E3 from South Carolina, we learned that we will continue we had a conference that was entitled Embracing Diverse Communities. We decided that we will continue the conference as a biannual conference entitled Embracing Diverse Communities. And we had the theme, some of the themes were empowerment and education. And some of the things that we learned to continue a database to support some of the cultural sensitivity research, support a community-based delivery model, trying to get the universities to support our Zoom effort a little bit more. We felt that we, really needed more university support with the Zoom, account in that area. So we'll do more efforts in the future to kind of work towards that. Also, the university stated they will support us more with the team model in the future as far as the technology. Also, a major support that we had was VR in the Orangeburg area and also in the Florence, South Carolina area. And also we had major support from South Carolina Commission of the Blind in Orangeburg and the Florence, South Carolina area. Some very important relationships, professional relationships that were gained in this effort were working with faith-based groups. That was very positive, and meetings with pastors, the AME Community Advisory Board was established, and we were able to develop a resource guide. It was a great part of Project E3. And also we had several trainings that were well received, and we received some great feedback on forums regarding 2 trainings, especially Social Security and the motivational interviewing. Our trainings were extremely helpful in the day-to-day life, according to many of our participants. That is our report from South Carolina.
Get unmuted. Thank you. Sounds good. Any questions for Dr. Cassandra Sly-Conway? I'm looking through my notes to see if I have any questions. Good to hear that you're continuing the conference. I attended at least part of it, and it was really well put together. So great information.
Thank you. Thank you.
And you said you all developed a resource guide. If you don't mind sharing that, that will be something we could put on our website as an example that others can draw from in case they want to replicate something like that.
Okay. Sure.
Thank you. All right, moving on to the next state. Looks like we're to Virginia.
Okay, this is David, and then Johans might have some other updates for his area that I don't have access to, but we have a couple things that I'm excited about that we're working towards. We are at the beginning of something called the CSEP grant, which is a Department of Labor grant through the Older Americans Act. And one of the things we are going to do in the 3 areas is actually utilize the IRT model. And we've identified partners in some ways based on how we work to identify partners related to the Targeted Communities project. So on our steering committee for that grant is myself and our director of Centers for Independent Living, who is the liaison between the CILs and our VR agency, and a person from adult education. And as a precursor to moving forward in the 3 areas of the state where we received extra funding, we are in the process of planning some IRT trainings that will be for those CILs and the adult ed and any other partners. We're going to try to use this not just for the grant, but to also bring up some other pieces of what we learned in targeted communities. And we're going to, I believe I have permission that we're going to use some of the branding around the Targeted Communities logo. So we're going to start each with a little bit about how Virginia and VR used IRTs through this grant as a kind of hope that it will help us build more communities. So that's an area we're really excited about, especially because it's areas that we were not in. So one of the areas is far southwest Virginia. Another area is actually here in the Capital District, Richmond, Petersburg, and the third is the Eastern Shore. So 3 areas we were not in for targeted communities. We think this will help expand what we're doing around the state. The next update is we're actively beginning a new area with an advisory council, and it again is based entirely on what we did with the other groups. And this is going to be targeting the area of the state that is called the Peninsula Northern Neck. It's the area adjacent to where the Hampton community was. And what's exciting is we're calling the work group the Peninsula Advisory Board. And we are framing it as this offshoot of that project. In the opening meeting is going to be February 8th, and we were able to get for the kickoff speaker, the Honorable Tina Vick, who is the Vice Mayor for the City of Newport News. And even though it's not necessarily her area, having someone with that kind of clout be the opening speaker should be really exciting, and we're hoping it gets more people to be involved. Also, in that opening that went out to all of the stakeholders, we thought to include right off the bat, we included in the invitation a little bit of information about community academies, the motivational interviewing that we did, the Your Money, Your Goals trainings we did, the trauma-informed care, and some of the other trainings. So in that opening call to action, we included a little bit of what's in it for us. And I think that's going to go a long way to generate some additional support. And then the last area I'm excited about that we've been working is we've been doing a lot around the financial empowerment work in Virginia. One of the things we were able to do towards the end of the actual grant was get a small group of VR staff trained as kind of financial coaches, not with the expectation that they use that skill set to actually provide in-depth financial coaching, but really we hope that those individuals, when they're working with clients who are in poverty, they might be able to better triage issues or know what other groups to bring to the table. And I think we were able to, over 3 groups of training, get roughly 30 VR staff trained in this. It was pretty intensive. 8 hours a day for 6 days of training. And we purposefully utilized the trainer who developed the curriculum for the Cities for Financial Empowerment. That's the group behind things like Bank On. If any of your states have Bank On projects or financial empowerment centers, one of the reasons we wanted to use that program is there are 2 CFE sites in the state of Virginia, and we wanted to be able to be speaking the same language, but also better partner. And so in our Roanoke area where they have that grant, in talking with them, we've been able to get a spot on their advisory board, and they have allowed all of our VR clients that go to that office, even the ones that don't live in the city of Roanoke proper, to receive free financial coaching in an ongoing hands-on way. And again, we don't necessarily have the time, the staff, or the capacity to provide 10, 20, 30 hours of that kind of service. But understanding where someone's needs are can allow us to better target services and help connect our clients to other things they need to be successful with work. And so those are some of the big updates. And then the last thing, I guess, we have we made a video that we should get back in the next few weeks. And the video included interviews with our counselors and the staff in each of the offices that had targeted communities, and an additional interview with our commissioner, my boss, our field services director, and some other stakeholders. And this is going to be used as a training video for new counselors going forward. It's going to be on our SharePoint site, and we're going to ask folks to use, but also it will be able to be used in those early advisory group meetings when a new area is formed, or perhaps at a community of practice, to kind of help sell why this can help so many groups. Because the video wasn't just VR staff, but it included some of the adult ed staff, some of the workforce partners, some of the Centers for Independent Living staff. And we're excited about that. And I think that's all of our updates. Unless Johannes has more.
Oh, sorry about that. Johannes, did you have more? I don't know if Johannes is still on. So yeah, thank you, David. That's great information. Sounds like you've had a lot of successes in Virginia. Great information. Interested in the financial empowerment. You said it's the Cities for Financial Empowerment. Is that right?
Yes.
Okay. Awesome. So I've gotten a lot of information today, and I appreciate those of you who've shared. All right, thank you. Looking through, trails, teaming resources for alignment through integrated and leverage services. That's awesome. Looking forward to getting more information about trails. And one of the things from Dr. Cassandra Sly Conway's conference, I know there was a big ask, and some of you who participated in that probably remember this. There were some people who asked about grant writing training. So I had that kind of on my short list of things to potentially include for our training. But today it seems to be that your biggest area of request, one of your big areas, was the IRT for your staff, in some other areas that we'll be addressing. So if you have any other things that come up, please let me know, and we'll try to integrate that in with our meeting starting in February. Anyone else have anything they want to add or talk about in our last few minutes before we get off? For February, we'll be getting back on the 3rd Thursday. Is that still good for everybody? I know this is not the 3rd Thursday, this is the 4th. So for February, put that on the calendar. It would be the 18th. Is that still work good for everyone? Okay, we'll keep it on the 3rd Thursday at 1 p.m. Central Time. And we'll get the information out and start planning for that. Thank you for that additional information in the chat, David. I appreciate that. And if there's nothing else, we are looking forward to convening our meeting in February on the 18th. Please let your coworkers know if you want to invite others. They are more than welcome to join us and attend. we'll try to get that meeting and a speaker lined up fairly soon so that you'll have that time blocked off on your calendar. Again, thank you all for presenting today and sharing information. It's really been helpful. I've enjoyed hearing from you, and it's good to see you and to talk with you. And if anything comes up in the meantime, please reach out and let me know how we can help. If we can connect you or provide some resources or help, we're happy to do that. I think that concludes our meeting today. Have a great rest of your day.
Thank you.
Bye.
Bye.
Thank you.